I actually grew up not too far from here over in Placentia. And so we had horses and I had this freedom of just riding the hills with my brothers and sisters. There were 5 of us and we just had a great life. My dad was a pharmacist and my mom was a stay-at-home mom. I only applied to Cal State Fullerton. My parents didn't have a lot of money and it was close. I could ride my bike. I loved it. I think for me, what it was the professors were so into learning. They were excited about the material and that light bulb, whoa, this is so cool. I'm actually learning something. Miles McCarthy, he got to know me and I got to know him because I was interested in health professions and I'd be visiting with him all the time. It's people that got me excited about learning that I'm always grateful for. Fast forward, I was in pharmacy school, actually ended up doing a residency right after I graduated here at UC Irvine Medical Center. And while I was there, I went to a meeting and there was a beautiful display of like eagles and glaciers and mountains. And I stopped and talked to the gentleman that was there. We got along great. And he happened to be the head of the pharmacy program for the Indian Health Service. They called one day from Pine Ridge Indian Reservation. That's what changed my career right there. I got around these other people that wanted to make a difference in the world, and it was just so much fun. I learned how to work with the community and to be able to make an impact with the community and listen to what they said.
She was looking to do good in the world and for adventure, and so she found a career path that, has both of those.
Her trajectory through the U.S. Public Health Service is, it's a moonshot there. She went through the ranks and was appointed as the Chief Pharmacy Officer, in fact, the first woman Chief Pharmacy Officer in the United States history, and was an Assistant Surgeon General. The rank of Rear Admiral is pretty much as high as you can get in the U.S. Public Health Service.
The United States Public Health Service Commissioned Corps is a branch of the military. We are actually an unarmed branch of the military who work in our daily jobs, some at the Indian Health Service, the Bureau of Prisons, the NIH, the FDA, the CDC, but we are the deployable health force, which means that if there's Ebola in Africa, we go. If there's a hurricane, an earthquake, we go. And certainly in COVID, 2/3 of our officers deployed all around the world.
If you can protect public health anywhere in the world, you've also protected American citizens because our globe is so small these days. She's been to Africa, she's been to Hurricane Katrina in New Orleans, she's been to Detroit with the water crisis, the Zika virus. She went where there was a need.
In the midst of things that are seemingly insurmountable, Pam Schweitzer starts fixing things.
She truly is a force of nature. Everyone wants to follow her. She knows exactly where the vision needs to be. She articulates that vision, really understanding big picture ideas like how to improve global health, how to increase healthcare to Americans, particularly those underserved. So really big strategic ideas, but combines them with the know-how to, get down in the weeds and make things happen.
The way she approaches projects, big and small, is to get things done efficiently, and she has a knack, and I think she really enjoys assembling teams.
She is really, I think, continuing to beat the doors down about how can we help Americans get care where they live in a cost-efficient way and improve their health. And she believes that the key to that is to empower pharmacists in local pharmacies, because that's where people go. It's a lot easier to get to a local pharmacy than to a major hospital or your physician's office. And she really laid the groundwork, which we utilized in COVID, both for testing and providing COVID vaccines. She really helped lay the groundwork over a number of years on how to empower pharmacies and pharmacists to make that happen.
She is always planting seeds within not only the Commission Corps, but with public health officials nationally and internationally. This empowers people at every level to create change. And she does that better than anyone else I have ever met.
She's a trailblazer for women in leadership positions within the United States Public Health Service. And when I went to her retirement ceremony, absolutely beloved by all. She's a rare bird, and I just wish there were more people in the world like her.
Pam is one of my favorite people, and she's made an incredible impact on the Commission Corps, on Health and Human Services, on this country, and I do believe the world.
She's always proud of where she's come from, and I know she's very proud of her association with Cal State Fullerton. Forever a Titan.
I am so proud of Pam. She represents the best of what we have to offer Cal State Fullerton. She came here to get a degree, and she just shot out like a cannon. She really is amazing, and she's ours. We helped grow her.